y'all, my name is Megan. I'm a student physical therapist, and today we're going to focus on gait training using crutches. Our focus for the day is going to be different gait patterns for walking and then ascending and descending stairs. Once you've had these fitted for your patient and you apply this bad boy, you're ready to go.
Before you begin gait training, you should adjust the height of the crutches and hand grips so that they are appropriate for the patient. You can do so by checking the height by inserting 2 fingers under the axilla to the axillary pad, and then double checking that the wrist crease is lined up with the hand grip. After that, the patient is ready to start ambulating under the weight-bearing conditions designated by the physician. The point gait pattern requires balance because the patient only has 2 points of contact at one time, one crutch and the contralateral leg progressing forward at the same time and making contact with the floor simultaneously, then followed by the other crutch and other leg moving forward and touching down on the ground at the same time. This technique is used for patients who exhibit enough stability and mobility to use a more natural gait pattern. And for those that have a weight-bearing status of weight bearing is tolerated and full weight bearing on both lower extremities. There are several variations to the 3-point gait pattern. The first shown is a 3-point step 2 with both assisted devices advancing forward, followed by one step with one lower extremity and then the other, both coming into line with the assistive devices. Next would be a 3-point step through gait pattern, where both assistive devices advance forward, followed by one step, and then the next step is going to pass through the line of the assistive devices. Both of these require weight bearing in both lower extremities, could vary between partial weight bearing is tolerated, and full weight bearing. In a 3-point swing 2 gait pattern, both crutches advance simultaneously forward, followed by the simultaneous advancement of both lower extremities to be in line with the assistive devices. In a 3-point swing through gait pattern, both crutches advance simultaneously forward as well, followed by the simultaneous advancement of both lower extremities beyond the line of the assistive devices. Both of these gait patterns are typically used with a patient who has a non-weight bearing status in one lower extremity. The patient's arms and other lower extremity must be able to support all of their weight. In a 4-point gait pattern, there are 4 contact points. In a 4-point step 2 pattern, one assistive device advances, then the other, then one lower extremity, and then the other, both lower extremities coming into line with the assistive devices. In a 4-point step through gait pattern is a little bit more natural. Your 4 points of contact are one assistive device, followed by the opposite lower extremity, then the other assistive device, followed by the opposite lower extremity. All of these gait patterns are based off of the patient's weight-bearing status, upper extremity strength, coordination, and balance. Let's tackle the stairs next. One easy rule to remember is up with the good, down with the bad. These next few examples are for patients who are going to be ascending a curb or stairs that have no handrails.
In this gait pattern, the patient will ascend the stairs leading with their uninvolved or strong leg, followed by their involved leg and crutches to the same step. The opposite pattern is used when going down the stairs, with the assistive devices and the involved leg going first, planting down on the same step, followed by the strong or uninvolved leg. These rules apply for any weight-bearing status when ascending or descending a curb or stairs without a handrail. Remember, when going up the stairs, the patient will lead with their strong or uninvolved leg, and on the way down, they will lead with their involved or weaker leg and the crutches at the same time. When teaching a patient to descend stairs or a curb, they should suspend their leg between the assistive devices so that their foot does not catch on the curb or stairs. This could increase their risk for falling, or break their weight-bearing precaution, or cause further injury. The next few gait patterns are for patients who are able to use a handrail when ascending and descending stairs. Typically, you would want the more stable surface on the contralateral side of their involved or weaker leg. Here, the patient is using the handrail on the contralateral side of their involved leg, and also bringing the crutches with them so that they have them when they go up and down the stairs. These are just a few ways the patient can bring their crutches up and down the stairs with them. Doubling up the crutches on their involved side and then either using the hand grip or tucking them under their armpit and using them as one crutch. You would only use this pattern if a patient is able to bear weight through their involved side. When guarding a patient who is ascending stairs, the therapist should guard behind the patient and towards the weaker or involved side and ascend the steps with the patient with their base of support on 2 steps. This is not how you guard a patient who is descending stairs. When a patient is descending stairs, the therapist should guard in front of the patient and toward the weaker or involved side. Make sure to educate the patient on proper position of the crutches during standing and locomotion. Do not hang on the axillary pads, for this could cause serious injury to structures in their armpit. As you can see, there are several different types of gait patterns you can use that are solely based off of the patient's weight-bearing status, their upper extremity strength, balance, and coordination.